Gold standard versus standard of care. Welcome to the Everything Surgery podcast, where we dissect the extraordinary. Today, we are delving into two foundational yet distinct concepts in the world of medicine and surgery: the gold standard and the standard of care. Understanding the difference between these terms is crucial for clinicians and anyone interested in the practice of modern medicine. Let's begin with the gold standard. When we talk about the gold standard in medicine, we are referring to the best available diagnostic test, procedure, or treatment for a given condition. This is the benchmark by which all other methods are measured and compared. It represents the highest level of accuracy or efficacy that science and current medical knowledge can offer. The gold standard is used in research as a reference point to evaluate new alternatives, whether these are simpler, more affordable, or less invasive options. For instance, when introducing a new blood test, its performance is often measured against the gold standard, such as a biopsy. The gold standard is grounded in objective, high-level evidence, often stemming from systematic reviews and randomized controlled trials. However, while the gold standard represents the ideal, it is not always practical or available. Sometimes, it is too expensive, invasive, or requires specialized expertise, making it unsuitable for routine use in every clinical setting. Importantly, the gold standard evolves as technology and evidence advance. For example, laparoscopic surgery has replaced open surgery as the gold standard for certain operations. Some classic examples include coronary angiography as the gold standard for diagnosing coronary artery blockages and biopsy for diagnosing cancer. On the therapeutic side, surgical appendectomy was once the gold standard for treating acute appendicitis, although in select cases, antibiotics are now challenging that position. Similarly, total hip arthroplasty is the gold standard treatment for end-stage osteoarthritis of the hip. Now, let's shift to the standard of care. The standard of care is the level of medical care that is legally and professionally accepted as appropriate and responsible for a given patient under specific circumstances. It is what a reasonably prudent healthcare professional would provide in a similar community or specialty. This concept defines what is considered proper medical practice. The standard of care is especially important as it serves as the central criterion in malpractice litigation. If a healthcare provider deviates from this standard without proper justification, it could be considered negligence. Unlike the gold standard, the standard of care is community-based and considers available resources, local expertise, and institutional guidelines. For instance, the standard of care in a tertiary hospital may differ from that in a rural clinic, but the principle of prudent care remains constant. Clinical practice guidelines, evidence from studies, expert consensus, and a balance of benefits versus risks all inform the standard of care. It tends to adapt more quickly in practice than the gold standard, changing as new therapies, drugs, or common protocols emerge. For example, administering antibiotics within 1 hour before a surgical incision to prevent infection is a standard of care. Prescribing adjuvant chemotherapy for a certain stage and type of breast cancer, following guidelines from recognized oncology societies, is another. Obtaining informed consent before surgery is a universal standard of care. And, for a stable patient newly diagnosed with type 2 diabetes, the standard of care is to begin with lifestyle modification and metformin as the first-line therapy. Key differences summarized. Let's recap the main distinctions. The gold standard is the scientific benchmark, the best test or treatment based on the highest level of evidence. It is relatively fixed until a new, superior method is proven, and it may not always be practical for routine use. The standard of care, on the other hand, is the legal and professional benchmark. It defines what is considered acceptable and responsible practice. It is more flexible, adapting to local resources and patient factors, and must be applicable in everyday clinical settings. Importantly, while the gold standard is not a direct legal standard, the standard of care is central to legal judgments about negligence. How do these concepts interact in clinical practice? Often, the gold standard is incorporated into the standard of care, but the two are not interchangeable. Let's consider a practical scenario. A patient arrives with signs of a bowel obstruction. The gold standard diagnostic test here is a computed tomography, CT, scan of the abdomen and pelvis with contrast, as it provides the most accurate information about cause and location. However, the standard of care involves a sequential process, starting with a history and physical examination, moving to basic laboratory work and plain abdominal X-rays, which are practical first steps, and If the diagnosis remains unclear or surgery is a consideration, escalating to a CT scan. Timely surgical consultation is essential if needed. Failing to appropriately escalate to the gold standard test when indicated, or delaying surgery, would be a breach of the standard of care. To summarize, the gold standard asks, what is the best possible tool or treatment? The standard of care asks, what is the right and responsible thing to do for this patient, here and now, given all circumstances? Thank you for tuning in. If you enjoyed this discussion, please like, share, and subscribe. This is Everything Surgery, where we continue to dissect the extraordinary in healthcare.